I try to avoid what gives you diabetes.
For many older Americans, that's not as easy as it sounds. Today, incidence of diabetes is highest among adults aged 65 to 79. Being overweight or obese, losing lean muscle to fat, and finding that fat shifting to the waist and hips helps increase diabetes risk.
We found it surprising that the relationship between adiposity or body fat and diabetes was so strong among older adults.
Our study suggests that obesity in older adults may also have health consequences, specifically as it relates to the development of diabetes later in life.
Doctors Mary Lou Biggs and David Siskovic from the University of Washington and co-authors studied more than 4,000 adults aged 65 and older from 1989 to 2007, looking at multiple measures, including weight, height, body fat, and waist size.
If you were in the upper fifth of the population that we studied, the upper 20% of the population, in terms of multiple measures of adiposity, you had a fourfold increased risk of developing diabetes late in life.
Individuals who gained 20 pounds or more between the ages of 50 and 65 had an increased risk of diabetes that was 2 to 3-fold times higher than those whose weight remained more or less stable.
The study appears in this week's JAMA, Journal of the American Medical Association. This map, provided by the Centers for Disease Control and Prevention, reflects the time period examined in the study when it comes to the rise in overweight and obesity nationwide. In 1989, most of the country had their weight in check, reflected by a mostly blue map. Fast forward 17 years to 2007, and it's a much different story.
Many states have prevalence rates of obesity of greater than 25% or even 30%.
Right.
That is reflected by the higher number of red and orange states.
I think that the results affirm the importance of weight control during middle age and suggest that weight control remains important into older ages in terms of reducing diabetes risk.
Catherine Dolf, the JAMA Report.